Okay, first aid for little people. The purpose of this lesson is to prepare kids from kindergarten through 4th grade as safety ambassadors who can help the entire family learn how to recognize an emergency, how to call for help, and what to do until help arrives. The lesson is also there to teach young children basic first aid skills. Okay? Some objectives of this lesson are to have children learn how to recognize that emergency, learn the emergency action steps, check, call, and care. The posters are very helpful for that step. Learn how to care for bumps, cuts, and broken bones. Learn how to help someone who is choking. This is age appropriate. So for very little kids, we're not going to go through all of the steps to really help somebody who's choking, the back blows and the abdominal thrust, just because they won't be able to perform those skills. But we have a different lesson plan for them. How to recognize poisons is another objective. We have our poison jars that I'll get to in a little bit, but this is a very helpful material that we take with us. Very eye-opening, especially for the adults. And then how to prevent burns and how to care for minor burns. So to start off, whenever you're teaching a lesson, you want to introduce yourself. First name is fine, Miss or Mr. is fine. And then a brief explanation of the Red Cross. So what we do there. And we want to keep it in simple terms. So we want to say something like, we're people who help others by teaching them how to stay healthy and how to stay safe. Okay? For older kids, we can go into more details about disaster relief and those kinds of things. But mostly we just want to let them know that we're there to teach them to be healthy and safe. For the first aid for little people, we want to say today we're going to talk about emergencies and how to help people who are hurt. We start off by talking about what is an emergency. We want kids to really think about what they already know is an emergency. We ask for examples, certain injuries, loss of blood, weather-related things, poisonings, trouble breathing, like choking, or dangerous situations. Then we want to talk about what are some types of injuries or illnesses that children think are emergencies. Things like severe bleeding, being poisoned, animal bites, head injuries, those kinds of things. It's important that we ask them questions as well and make sure that they're raising their hand. A lot of times children just want to blurt out everything and then things can kind of get a little out of control. The next thing we talk about is how to recognize emergencies. So there are three categories that we can teach to children about recognizing emergencies. Those are sights, sounds, and smells. Something that they could see in an emergency would be lightning or blood, okay, broken bones. Sounds would be breaking glass or sirens. Smells could be smoke or gas or just something that doesn't smell right. It's important that they can pick up on those signals for emergencies because they can use that information later on in the lesson. Next, we'll talk about what we should do when emergencies happen. How can we stay calm? Being calm is the most important step. It's not on our emergency action steps, but it's very important to mention that one first and to go through with them and say, what are some things you can do to stay calm? Why is it important to stay calm? You can practice deep breathing with them, so just one inhale, let it out, count to 5, those kinds of things. And then we want to tell them about the check, call, care posters, which are very brightly colored, attention grabbing. It worked really well. These posters also have additional information on them, so they're very good to rely on in case you forget maybe some specifics about a step. So they have questions on there like, is it safe to approach when you're checking the scene? Is it okay for this person to go up and really help a person who's hurt? Are there any dangerous things around that could hurt that person if they try to help? So that's check. We want to check the scene and we want to check the person. When we teach a child to check a person, we want them to be cautious. Okay, if there's blood, we don't want them to touch blood, those kinds of things, or any dangerous materials. But we want them to go up and make sure that the person is okay if the scene is safe. We have them shake their shoulder and say, are you okay? So that's check. The next step is to call for help. If it's a non-emergency, so if somebody, like in this picture, this person hit their head, but they're awake and they're responding, the child will call for help from an adult. Either verbally calling for help or getting on the phone to make a phone call. Okay? If it's an emergency, flip the poster over, call 911. Okay? And then we can talk about what they need to say when they call 911. So all the question words. Okay? We also want to make sure that they know not to hang up the phone. They need to stay on the phone until help arrives. Okay, so we walk through those 3 steps. And during this time, children usually have specific questions about situations. They get into a lot of what if this happens, then what? It's good to answer a couple of those situations if they are realistic. Sometimes they get off on tangents about things they've seen in movies. We want to keep it really focused on some things that could really happen and make sure we answer those. But if there are a lot of what ifs, make a point to say, there are a lot of things that could happen, and these are just some of them. But if you have more questions, you can talk to your parents about those what ifs. Okay, excellent. We also want to make sure that they know to only call 911 in an emergency. No other situations. They don't call 911 if it's a joke or if they just want to see how people are doing. They only call in an emergency. You can also walk through whether or not to call an adult or 911. You can talk about these topics. You can say, if there's a fire, do you call for an adult or do you call 911? Okay, and pose those questions to them. You could say, the adult you're with is asleep and won't wake up. You tried shaking their shoulder and said, hey, are you okay? They're not responding. Would you call for another adult or would you call 911? Okay. You can ask the class those questions. Our last step then is to get into general care. We have that poster there at the end. This is where we get into our first aid skills. Okay. You can introduce the subject by talking about a first aid kit, because a lot of times this is what kids think of first, is a first aid kit. We can talk about how the first aid kit has materials inside to help people with minor injuries. Okay, and then we can talk about some of those injuries. Our care steps. The first thing we want to do is make sure the person is lying down, just like the poster says. We don't want anybody to move anyone else, especially when they're hurt. So we have the person lying down. We want to keep the person calm. So just like the kids practice a deep breath and counting to 5, they want to tell the other person to do that as well. And then we want to make sure that the person is at a normal body temperature. For little kids, this doesn't really make sense. It doesn't really make sense to them. So we can talk about if somebody's really cold, you give them a jacket. That would help keep their body temperature normal, keep them warm. Okay, so we can talk about that. For specific injuries like cuts and scrapes, the first thing we want to do to care is to wash the injured area with soap and water, and then ask them what that does. Okay, what does that do for the cut or scrape? Chances are they'll say it cleans the germs out, keeps it from getting infected. Kind of thing. We want to make sure that it's dry, and we put a Band-Aid on it. You can go through the first aid kit and show specific materials in here. So when you're talking about the cuts and scrapes, you can get out the variety of Band-Aids that we have in the first aid kit. Okay. We also want to demonstrate how to wrap larger cuts and scrapes, but those are usually for older kids who would be able to handle those skills. With really little kids, we would advise that they get an adult if somebody's bleeding a lot or has a very large scrape. Get an adult. For older kids, though, we can teach them how to wrap an injury. And for that, we have a gauze pad and a roller Band-Aid. And what we have the kids do is have 2 volunteers come up. One will be the first aid giver, one will be the first aid receiver, and they'll just put the gauze on the arm is what I usually do, and then they just wrap the Band-Aid around the arm. And it's just a simple covering a wound skill. After they've bandaged the wound, and if they think that it's bleeding a lot or it might be more severe, then they need to tell an adult or call 911 if it's an emergency. The next item we talk about is choking. Now, I said earlier with younger kids, we don't go into the specific skills to help somebody with choking, but what we do instead is talk about things that people could choke on. So we have a bag of balloons and rubber bands and safety pins, and small objects that kids could choke on. And we tell them that these things need to be picked up so that people don't choke on them. That's a way to prevent choking. If somebody is coughing really forcefully. They have something in their throat. Children should tell that person to keep coughing. Never leave them alone, but sit with them and tell them to keep coughing. If the person stops coughing and is choking, they have their hands up around their neck. We can even show this to children, ask them if they know what this means, universal symbol for choking. So if somebody starts choking, they need to make sure they call 911 right away. The last topic we discussed with first aid is the poison jars. And these, I think, are really neat because it's a very good visual aid for kids. So we have 12 jars here, or 6 sets. Each jar has either a candy or something edible, or a medicine, or a poison in it. Okay, that go together. So, for example, in these jars, these are sweet tarts, and these are Tums. Okay, we show these jars to kids to see if they can tell the difference between the candy and the medicine. A lot of times they can't. Sometimes, surprisingly, they know all of them because they know what clues to pick up on. I can pass these around to you, but these are very good to show children in the classroom, and it keeps them engaged. So with the poisons, we talk about what a poison is. It's something that can make somebody very sick. We can give them examples with the poison jars. We talk about that if somebody has swallowed something that they shouldn't have, or maybe we see a pill bottle or a chemical bottle spilled, and maybe a younger brother or sister has gotten into it, we need to make sure we find an adult right away or call 911. We also need to make sure that we emphasize that the person who's hurt or who is ill isn't left alone. So the child knows that they need to stay with the person who's hurt. And that's our first aid for little people.